Hello, everybody. This is Dr. Matthew Cavaiola. Today, I'm really excited to be talking to you today about hyperbaric oxygen therapy, one of my favorite therapies that we offer at Conscious Human Medicine. Let's get started. So a little bit about me. I was actually born in New Jersey. I grew up near Annapolis, Maryland on the East Coast. I went to the University of Delaware where I received my bachelor's degree in biology. I have a master's degree in human nutrition also from the University of Delaware. I received my doctorate degree from Southwest College of Naturopathic Medicine in Phoenix, Arizona, and also have a master's degree in acupuncture from the Phoenix Institute of Herbal Medicine and Acupuncture. So hyperbaric oxygen therapy, relax, rejuvenate, and heal. You can do all three of those things with hyperbaric oxygen. This is actually not a woman in a space shuttle. It's actually a woman in a hyperbaric oxygen chamber. And she is relaxing, rejuvenating, and healing. So what does a hyperbaric oxygen chamber look like? It looks like this. So this is a standard hyperbaric oxygen chamber. This is the Viteris 320. This is the hyperbaric oxygen chamber that we have in our practice. It's about 7.5 feet long, and this is a chamber that is all the way inflated. So up here you can see the hose connection where the oxygen compressor hooks up to the chamber. Up here we have the pressure gauge, which shows how inflated or how much pressure is inside the chamber. Here we have the release valve, which basically helps us to control the amount of pressure going inside the chamber. Here's a window where you can see the practitioner and the practitioner can see you when you're undergoing therapy. And here's another window down here on the side. So this is what a typical chamber looks like. Inside the chamber, there's a mattress and a pillow. It's very comfortable. You basically get in and you lay down inside, and the majority of people sleep when they're inside the chamber. So that's what a typical hyperbaric oxygen chamber looks like. What is the premise of hyperbaric oxygen? So right now we're breathing oxygen, hopefully we're breathing oxygen, and at sea level where we are right now, we breathe in oxygen at something called 1 atmospheric pressure. So when all is said and done, when we breathe in oxygen, our cells only absorb about 20% of the oxygen that we breathe in. Not very much. What's great about hyperbaric oxygen is that we breathe in either pressurized ambient air or pure oxygen that's pressurized. And the premise of hyperbaric oxygen is that basically the pressure is the thing that does the magic. It's the combination between pressure and oxygen that forces oxygen into our lungs, into our bloodstream, and down to the cellular level. And that's really the key, is that the pressure is able to force it into your body. And basically what happens is you're able to, your cells, once it gets down to the cellular level, your cells are absorb about 50% of the oxygen that you breathe in. That's just using ambient air. We also have something called an oxygen concentrator, and the concentrator basically helps to concentrate the oxygen and further increases the absorption inside the body. And it's been reported that you get about up to 90% of the oxygen absorption that you're breathing inside the chamber. So that's really the premise of hyperbaric oxygen, is that basically the pressure forces O2 down into the cells. And that'll come into play in a couple of minutes when we talk about mitochondria. So there's different types of hyperbaric oxygen chambers. You have a monoplace chamber, which is where basically only one person can fit inside the chamber. And you have multiplace chambers, where up to 14 people can fit inside a chamber. The majority of these multiplace chambers are in a hospital setting. Again, the Viteris 320 that we have in our office is a monoplace chamber. Typically, again, one person can fit inside the chamber comfortably, although we have seen that an adult and a child can fit inside the chamber. Oftentimes comes into play when we have kiddos who have autism or ADHD who want to be using the hyperbaric chamber, or you can actually fit 2 adults, feet to head. I wouldn't recommend fitting both feet facing the same way. And again, most of the multi-place chambers exist in a hospital setting. So chambers are typically either hard shell or soft shell. And again, the Viteris 320, the one we have in our office, is a soft shell chamber. So portability, it's great to be able to take this wherever you go. Most multi-place chambers or hard shell chambers are not portable. So once they're in the office for a long time. Monoplace chambers or soft chambers are 100% portable. You can even fit one of these once they're all broken down into their parts inside a regular size sedan. And I can attest to that because I've actually had to transport this thing a number of times. The pressures in the chamber, it depends. So a lot of the chambers inside of a hospital setting are typically chambers in the 2.2 to 3 atmosphere range. And then some of the chambers are known as a mild hyperbaric chamber, and that's the ones that we have in our office. They typically range from 1.3 atmospheres all the way up to 2.2 atmospheres. So the Viteris 320 that we have in our office is a 1.3 atmosphere chamber. So hyperbaric chambers in general, chambers that are able to deliver higher pressure and deliver pure oxygen often provide an advantage by increasing oxygen saturation and absorption in the body. Oftentimes, though, they do potentially come with a greater side effect profile. Not all the time, but they do have the risk of having a higher side effect profile. One of which is a fire hazard. Unfortunately, there have been a number of cases where there have been fires. And again, a lot of that's due to user error or just faulty chambers in general. And these typically happen in pure O2 chambers. So again, the chamber that we're using in our office is an ambient air chamber. So oftentimes there's not a lot of risk for these types of things happening. Greater patient discomfort. The more pressure that happens inside the body and also in the ears. So sometimes there's a little bit more discomfort with a higher atmospheric pressure chamber. And we'll talk more about kind of more of the side effects of hyperbaric oxygen in a few minutes, which are limited, but there are some things to watch out for. Also, there's something called free radical generation. We'll talk more about free radicals and what they are in a few minutes, but when you have this amount of oxygen that's being created inside the body or being forced into the body, sometimes what happens is that we have a kind of a detox reaction, and sometimes we generate free radicals, which aren't necessarily that great for the body to begin with. So sometimes with a higher pressure chamber, sometimes these free radicals are generated more often or at higher levels. Now, mild hyperbaric chambers, again, between the 1.3 and 1.5 atmospheric range, are widely studied and recognized as an effective, viable treatment option when higher pressures are unavailable. So again, if you can't go to a hospital setting or you're not able to afford it in a hospital setting or you don't have insurance, some of these mild hyperbaric chambers provide the same benefit, just not at the same levels in terms of the atmospheric pressure. So what are some of the mechanisms of action or benefits of hyperbaric oxygen? I mentioned the word mitochondria. Mitochondria are very, very important because they basically help our body create energy in the form of something called ATP. This is generated from the food that we eat. So food comes in and eventually it gets broken down into something called pyruvate and enters into this mitochondria here. And over time, we need oxygen being present to basically help break down this food into acetyl-CoA, enters into the TCA cycle here, and eventually goes into something called the electron transport chain. And the electron transport chain is crucial for producing ATP. You can also see here as a byproduct, the body also breaks down the food and oxygen into carbon dioxide and water as a byproduct, which is natural. So over time, ATP is the thing that we really is crucial. So ATP is basically energy. It's energy in its purest form. So when we eat food, we generate ATP, and we need oxygen to make that happen. So what happens if we don't have enough oxygen in the body? That so often happens with age or just lifestyle or oxidative stress. Oftentimes, it can lead to chronic disease, including things like chronic fatigue or fibromyalgia or even cancer. So some of these things are some conditions that happen with age are a direct result of not having enough oxygen or oxygen deprivation. So really important to be able to get adequate amounts of oxygen in our body as we age. So I mentioned the word oxidative stress. Oxidative stress is a known instigator of chronic disease development. Where does oxidative stress begin? It often starts with, of course, a poor diet. Poor diet, we see especially things along the lines of eating trans fats, hydrogenated fats, processed foods. All of these things are known instigators of oxidative stress. Smoking is one of the leading causes of oxidative stress. Also, secondhand smoke can also contribute to oxidative stress. Alcohol. Alcohol abuse, even smaller amounts of alcohol can contribute to oxidative stress in the body. It basically puts way too much pressure on the liver and elsewhere throughout the body. So it actually basically your mitochondria over time become damaged with all those kinds of things. Medications, drugs, environment. So we're seeing that our environment plays a large role in oxidative stress as well. Things along the lines of pesticides and heavy metals and phthalates. So some of these chemicals are known instigators of oxidative stress in the body. And then just aging. As we age, as we get older, we have a higher level of oxidative stress in the body. So over time, oxidative stress, as I mentioned before, can lead to something called free radical generation. And these free radicals really are pollutants inside the body. They create a lot of havoc, and over time they can damage virtually every single membrane and cell in the body, including the lipid bilayer. And the lipid bilayer, without kind of getting into all the technical aspects of things, the lipid bilayer is a protective encapsulation around cells, and it basically allows things inside and outside the cell. It also basically is fluid over time. When we get free radicals that get deposited inside lipid bilayers, our bilayers become more rigid, and we want them to be very fluid. We want them to be moving, because when they move, our cells are able to move better. We have more fluidity, and this is definitely applicable in the brain. As in the brain, there's lots and lots and lots of fat, and there's a lot of lipids found throughout the brain. So over time, when we have more free radical generation, our brains can become solidified, essentially, where it's not moving and not as fluid as it should be. So that's one application of why free radical damage, especially to lipids in particular, is bad. Proteins and DNA synthesis. So over time, we need to have DNA repair. We need to have DNA to basically have different functions throughout the body. So when our DNA becomes damaged, that can, of course, lead to a disease progression as well. And then oxidative stress can also accelerate aging. So if you're already aging to begin with, oxidative stress accelerates that process. Oxidative stress can also damage the mitochondria. And like we mentioned earlier on the previous slide, the mitochondria are necessary for producing ATP or energy. So think about if you have oxidative stress, it damages the mitochondria. We can't produce energy as well as we should. So that's really a detrimental to our health. This is one study down here at the bottom that showed a marked decrease in blood free radical metabolites and improvements in subjective feelings of energy in 15 folks who are following 40 minutes of hyperbaric oxygen. So hyperbaric oxygen can actually lower the amount of free radical generation in the body. And it also, because of that, it can actually improve subjective feelings of energy, or just energy in general. So we're able to basically produce more ATP and feel better energetically. So hyperbaric oxygen is known to do that. What are some other benefits of hyperbaric oxygen therapy? Number one, it can stimulate the production of body stem cells, and stem cells are necessary for repair and regeneration throughout the body. And this basically this continual turnover. So stem cells help our body to be able to repair and regenerate, and we need that to heal as we age. It can also help to boost the immune system. So a lot of folks who have immune dysfunction or immune compromise, things along the lines of viral infections. I can think of a few things like Epstein-Barr virus and cytomegalovirus and Lyme disease have all been shown to be helped with hyperbaric oxygen therapy. HBOT can also decrease swelling and inflammation. It's been shown that 1 to 2 hours of HBOT, which is pretty standard treatment, is equally as effective as taking aspirin to reduce inflammation. So that's pretty great. I mean, this is very anti-inflammatory. We know that the precursor to most chronic illness is inflammation. So if we can get in a hyperbaric oxygen chamber, it can reduce the amount of inflammation and help us prevent disease as well. So even if we don't have chronic disease, it can certainly help us prevent disease in the long run. It helps the body to clear toxins and increases the body's ability to fight infections. It promotes regeneration of injured tissues. One thing I won't go into a lot today, unfortunately, is hyperbaric oxygen's capacity to be able to heal wounds. It's very, very great, especially for things like diabetic ulcers and neuropathy. It's been shown to regenerate nerves and also heal non-healing ulcers. So this has been used for a long, long time to treat diabetic ulcers. Reduces fatigue. And again, the fatigue mostly due to chronic inadequate oxygen supply to the cells and tissues of the body. So again, that's really, really important. People who continually fly, frequent flyers, oftentimes feel like they have jet lag. And it might just be me, but as we age, it seems like jet lag gets worse and it's harder to recover from jet lag. So hyperbaric oxygen therapy can actually help individuals who are suffering from jet lag, who are frequent travelers. It also decreases ligament and tissue healing time. So if we have an injury or if we have chronic injury, it can actually expedite the healing process. It also has been shown to successfully treat traumatic and ischemic brain injuries as well, which we'll talk about in length here in the next few slides. So very, very great for the brain tissue as well to be able to basically perfuse the brain with more oxygen that's been depleted. So here's a few conditions that have been treated with hyperbaric oxygen therapy. As I mentioned, fatigue. Again, a lot of this is chronic fatigue patients. Fibromyalgia, folks who have undergone strokes, multiple sclerosis, Parkinson's disease, autism, any type of autoimmune or inflammatory conditions, especially things like arthritis, Crohn's disease, and ulcerative colitis, folks who have had concussions or traumatic brain injuries, individuals who are suffering from PTSD, oftentimes as a direct result from those, or separately, wounds, ulcers, and slow healing time, folks who are recovering from surgery. This is another great benefit of hyperbaric oxygen. I've had a number of patients who have used the chamber after recovering from either plastic or routine surgeries. Really, really great. Lyme disease, and also it's been shown to be helpful for cardiometabolic disease as well. So let's talk specifically now about hyperbaric oxygen therapy in the brain. So HBOT has been used extensively over the last 50 years to treat stroke and other insults to the brain, things like stroke, concussions, traumatic brain injuries, carbon monoxide poisoning, encephalopathy, which is basically a swelling in the brain, cerebral air embolism, and also acute spinal cord injury. It's also been used, believe it or not, for near hangings and near drownings. That's actually an indication for hyperbaric oxygen therapy. SPECT scanning is an imaging study that has been used to evaluate brain perfusion. It can actually show changes in blood perfusion and metabolic changes impacted by stroke and other types of brain injuries. And what's great about SPECT scans is that you can actually help to guide protocols over time to see how people are doing over time with further treatments. So SPECT scans, we'll look at a SPECT scan here. This was an individual, a 17-year-old autistic child who had undergone a series of hyperbaric oxygen therapy treatments. You can see here on the left-hand side, what we're looking for here is more red and yellow, because the red and yellow indicates a higher level of oxygen perfusion, blood perfusion found in the brain. Here on the left-hand side, very little red and yellow. And actually over here, following the series of hyperbaric oxygen treatments, you can see here that it's very well lit up with red and yellow. So this is a really cool case to see the pre and post hyperbaric oxygen therapy treatment and SPECT scan results. So post-concussion syndrome and hyperbaric oxygen therapy, it's been, we're seeing more and more hyperbaric oxygen used for traumatic brain injuries and post-concussion syndrome, which is a very real thing. A lot of these folks are veterans, athletes who have sustained repeated head injuries. And of course, those experiencing head injuries, whether it be during a fall or car accidents, we see a lot of these folks in our practice throughout their lifetime. And sometimes the symptoms, people don't even know that a car accident in their 20s has impacted them for 30 years. They don't make that connection. And that's really why we as naturopathic doctors really try to get to the root cause of our patients' problems and take a really good history, because sometimes you never know. Sometimes something 30 years ago could be impacting them now, and hyperbaric oxygen might be a viable option for them to heal up. Some military service members who receive mild TBIs fully recover within 30 days. Unfortunately, that's not always the case, and a lot of these individuals go on to report chronic symptoms following brain injuries. Things like headaches, balance problems, sleep disturbances, fatigue, memory problems, poor concentration, irritability, and anxiety. Also, a lot of these individuals undergo a post-traumatic stress disorder as well. They don't even know why. But oftentimes it's tied directly to a past history of traumatic brain injury. What's interesting is that the frequency and severity of these repeated head insults are also tied to emotional distress or pain. So the more frequent and the more severe the trauma was to the head or to the brain, it leads to a higher level of emotional distress or pain later on. One of the worst things is that these people they're looking for help, or they don't know that help is out there, and there's very few options for these people who are suffering from post-concussion syndrome or traumatic brain injury. Standard treatments are antidepressants, antipsychotics, anti-inflammatories, and opioid medications. We now know that opioid medications, there's a huge, huge problem in this country and worldwide with addiction to opioid medications. And if there's a viable option to be able to get people off of these medications, we're going to do whatever we can to be able to help them do so. And now hyperbaric oxygen is being used as a treatment to help these individuals who are suffering from post-traumatic brain injury and post-concussion syndrome. So what are the effects of a traumatic brain injury on the brain itself? Well, the immediate effects are complex. So there's a lot of things that are happening, activation of certain cells, deactivation of certain cells, damage to something called the blood-brain barrier, where you're getting a floating of proteins across the blood-brain barrier where they shouldn't have been before, or blood or other types of fluid. So really there's a lot of changes that are happening after a traumatic brain injury. What happens is that oftentimes this leads to a disease process. Usually it's not just the traumatic brain injury that happens, but so often is the case where it leads to this whole cascade of events and actually a disease that happens over time. So following the head injury, inflammation is one of the biggest things that happens. Neuroinflammation rapidly ensues. So inflammation, as you might know, inflammation typically is designed to be reparative or defensive or protective. But unfortunately, so often is the case where we have this inflammatory reaction that goes on to persist well beyond its beneficial effect, leading to secondary injuries over time. And this is what leads to this chronic neuroinflammation leads to neurological and some of the other symptoms that we see in folks who are suffering from post-concussion syndrome and traumatic brain injury. So this was what we're seeing now, again, in veterans specifically. Late 2017, the Department of Veteran Affairs, the VA, announced it would start to offer hyperbaric oxygen to veterans with persistent PTSD resistant to standard options. And again, a lot of the options that they're given are not working, or they're on them for a long time and they're still suffering, unfortunately. So one study in particular showed improvement in TBI symptoms following 40 hyperbaric oxygen sessions, which seems like a lot, but actually this is pretty much the standard protocol. 40 treatments minimum for some of these folks for 60 minutes. And that's pretty standard treatment length is 1 hour. Another study showed symptomatic and moderate cognitive improvement in 15 service members with post-concussion syndrome using the same regimen. So hyperbaric oxygen we're seeing as a potential great effective treatment for individuals who are suffering from post-concussion syndrome. This was a study by Dr. Paul Harch, who kind of is considered one of the fathers of hyperbaric oxygen therapy. This was a study that looked at blast-induced post-concussion syndrome and PTSD. And as you can see here, this was SPECT scanning that looked at the effects on the brain after hyperbaric oxygen therapy. Again, what we're looking for is the red. The red basically means that there's more blood perfusion. So often is the case where individuals who have had a traumatic brain injury or who have had post-concussion syndrome don't have perfusion to the brain, which leads again to some of these neurological and systemic type symptoms that they're experiencing. So as you can see here, this is after one treatment, we're starting to get some of the red showing up throughout the brain. And after 40 treatments, look at how well lit up the brain is. So remarkable blood perfusion to the brain following 40 treatments of hyperbaric oxygen. Typically, that's about 2 months worth. It's basically five days a week or 3 to 5 days a week for a couple of months. And this is amazing because not only can you see the results in the brain with the SPECT scans, but these people had marked improvements in memory, concentration, executive function, quality of life, which so often is the case that's completely wrecked because of their traumatic brain injury. Quality of life, they don't have a quality of life. Reduction in headaches, concussion symptoms, depression and anxiety. They had an increase in their IQ of 15 points following 40 treatments. and reduction in PTSD symptoms by 30%. So these types of improvements had never been seen in the research before this study. So this is a really, really great study looking specifically at blast-induced post-concussion syndrome, PTSD in service members. So let's talk about athletes. Athletes have been using hyperbaric oxygen for quite some time to help them with a number of factors. One of my favorite tennis players, Novak Djokovic, look how pumped up he is in this picture. He's totally pumped. I think he's very excited about hyperbaric oxygen therapy. I think that's really what's going on. Anyway, he is one of the biggest proponents of hyperbaric oxygen therapy. He has been known to bring a smaller hyperbaric oxygen type device with him especially to the major tennis events, and basically get inside and sleep in it for hours after his long events. I mean, some of these events that he's undergoing are 4-hour, 5-hour, 5-set matches. So this is part of his recovery process, is to get in the hyperbaric oxygen chamber, infuse his body with oxygen, help his body recover for the next match, which oftentimes is 2 days later. So this guy, we all know he's an absolute animal, a machine on the tennis court, and hyperbaric oxygen is part of his healing routine. James Harrison, former football player, he recently retired, was an absolute beast. This guy took 15 years worth of beating in the NFL, which we know is kind of unheard of nowadays. And this guy, if you've seen any of his workouts, he's an absolute machine. But hyperbaric oxygen was part of his recovery process as well to help him with some of the head injuries that he experienced. Terrell Owens, you can say what you want about him. He just got inducted into the Hall of Fame. However, with that being said, he was kind of one of the first NFL players who put hyperbaric oxygen therapy on the radar. So I always like to talk about TO for hyperbaric oxygen therapy. Johan Santana, this is a really interesting story. This guy was dominant. He was a Cy Young Award winner in baseball, just had electric stuff, and unfortunately suffered a very bad shoulder injury, and was told, you may never play again, unfortunately. And what was really cool is that he underwent surgery, and as part of his recovery from surgery, he actually bought a hyperbaric chamber and was in that thing religiously, and went on the next year to actually pitch a no-hitter, which was kind of unheard of. And then Michael Phelps, who's actually from Baltimore, Maryland. So I was giving props for coming from my hometown. And Michael Phelps has been also known to get in a hyperbaric chamber for his recovery procedure as well. So I think we all know how great of a swimmer Michael Phelps is. So some really great athletes who are using hyperbaric oxygen to help them with recovery and energy and a whole variety of parameters. Chronic fatigue. So again, energy production is one of the biggest benefits of hyperbaric oxygen therapy. So chronic fatigue syndrome, for those who don't know about it, is an extreme fatigue. This is not just minor fatigue. Oftentimes it can't be explained by any underlying medical conditions. It's also been termed myalgic encephalomyelitis, which is a fancy term for chronic fatigue syndrome. Possible factors include hormonal disruption. So sometimes doctors kind of throw up their hands with chronic fatigue because they're not investigating or don't know how to investigate some of the potential root causes of chronic fatigue. Some of those include adrenal insufficiency or hypothyroidism or low testosterone or menopausal symptoms in women. Some of these things actually contribute to chronic fatigue syndrome, but are very much overlooked. And unfortunately, doctors don't have the same sensitivity or look at those types of hormonal disruptions the same way that naturopathic doctors do. Not across the board, but again, we as naturopathic doctors really take a really good look into hormonal disruption, especially with relationship to chronic fatigue. Environmental toxicity is a known cause of chronic fatigue syndrome. Again, things like heavy metal toxicity. So heavy metal toxicity and some of the other toxins affect the brain directly. They also affect the neurological system directly. So oftentimes the resultant symptoms of chronic fatigue syndrome, which is actually a culmination of symptoms, can result from environmental toxicity or long-term toxicity. One of those heavy metals that's been known to disrupt the neurological system and cause chronic fatigue is mercury. And mercury, unfortunately, we're typically found in fatty fish, and also mercury amalgams found in the teeth can cause long-term chronic fatigue in patients. Latent viral infections is also a direct known cause of chronic fatigue syndrome, especially latent Epstein-Barr virus, cytomegalovirus, and then, of course, Lyme disease would be kind of my top 3 choices. So symptoms not only include this extreme fatigue, but also people feeling kind of like they're in a fog, also been called brain fog, memory problems, forgetting where they are even when they're driving, forgetting where their keys are, and even beyond that. Depression, sore throat, sleep problems, trouble falling asleep or staying asleep. A lot of folks with chronic fatigue syndrome report that they feel wiped out all day long, but then they get in bed and then they're wide awake. Sometimes we call this being wired tired. Orthostatic hypotension. This is basically when you go from sitting or lying down to standing up, or to sitting, you feel lightheaded or dizzy. Again, this because oftentimes there's a direct relationship to adrenal or thyroid insufficiency, you feel this kind of hypotension that happens. Non-specific or specific joint and muscular pain. So people can kind of feel achy all over or have specific joint and muscular pain. The problem with chronic fatigue is that a lot of these individuals are unable to work and fulfill social and family responsibilities, and it's just sometimes just absolutely crippling and debilitating. So how can we help these individuals? There's a lot of things we can do in naturopathic medicine. I mentioned a bunch of sort of testing that may be able to help individuals, but hyperbaric oxygen is one known potential treatment to be able to help individuals suffering from chronic fatigue. The Journal of Chronic Fatigue Syndrome, in an article as early as 2003, looking at the relationship between chronic fatigue and hyperbaric oxygen, showed that, quote, certainly the immediate effect of hyperbaric oxygen therapy is to relieve cellular hypoxia, that is a feature of chronic fatigue syndrome. This goes all the way to the back of the earlier part of my presentation where we talked about low oxygen or inadequate oxygenation of the body can lead to fatigue. And again, part of that has to do with not feeding the parts of the body and the cells that make energy. So if we don't have enough oxygen, we don't make energy. Plain and simple. So again, when you're inside the hyperbaric oxygen chamber, it basically increases the amount of readily available oxygen that we can use to create ATP. A 2013 study 10 years later determined that hyperbaric oxygen therapy decreases the severity of symptoms and increases the life quality of chronic fatigue syndrome patients. That's beautiful. And this was, I think 15 or 20 treatments. So even a small number of treatments can go a long, long way for sufferers of chronic fatigue syndrome. Now, what's great is that you don't need to have just chronic fatigue syndrome. You can be experiencing regular kind of fatigue, I would say, too, and it can benefit you in that regard, too. So chronic fatigue syndrome and fatigue in general, hyperbaric oxygen is a great treatment for that. I wanted to talk about autism a little, just briefly. The prevalence, of course, of autism has dramatically increased in recent years. The cause, unfortunately, there's not one particular cause, but there's many factors that may be leading to the development of autism, including medications, viruses, including rubella, and again, CMV, environmental causes, pesticides, PCBs, toxic metals, sometimes the transference of some of these environmental causes from mother to baby in utero. So some of these things are caused even before a baby is born. Many of the chemicals, unfortunately, damage the mitochondria again, and also deplete something called glutathione. And glutathione is one of the supreme detoxifiers in the body. It's a free radical scavenger. It's found in large amounts in the liver, and it helps our body get rid of gunk, so for lack of better terms. So unfortunately, when we have these insults, it can result in behavioral disruptions, GI disturbances, and some of the other severe symptoms seen in autism, like limb weakness, ataxia or movement disorders, and also stroke-like episodes. So hyperbaric oxygen has been shown as a beneficial tool for autism. So this is a group of researchers who've been looking at hyperbaric oxygen for quite some time in autism. And what we're seeing is that there's a large degree of oxidative stress and inflammation in individuals with autism. And numerous studies have shown improvements in this oxidative stress, as we talked about earlier, and inflammation, as well as the improvement of neurological function and cognitive performance. One specific study showed a decrease in something called CRP, which is a systemic inflammatory marker, something called C-reactive protein. So it's a good way to measure the amount of inflammation that's happening in the body, and improvements in motivation, speech, and cognitive awareness in 18 autistic children undergoing 45-minute hyperbaric oxygen sessions. So again, 40 is kind of the magic number for some of these chronic conditions. And I had a kiddo who came in to see me in my practice. I think he was around 5 or 6 years old, and he came in with his dad, and he was coming in multiple times per week. What's great about this particular case is that you can see the dramatic, right on the spot kinds of improvements in kids with autism undergoing hyperbaric oxygen therapy. So what was really cool is that this kiddo was non-communicative, unfortunately. He had many of the telltale symptoms of autism, very bad behavior. But one thing that happened, when he was inside the chamber with his father actually noticed a dramatic improvement of his ability to maintain eye contact. His behavior improved. He was able to focus. He was playing a learning game when he was inside the chamber, and he was able to focus better. So really, really cool study, just a case study looking at the dramatic on-the-spot kinds of improvements. Unfortunately, he didn't go on to complete enough treatments to really notice a long-term benefit, but kind of a cool on-the-spot treatment case study. So more details on hyperbaric oxygen. I talked about some potential side effects, things to look out for: claustrophobia. This is an enclosed chamber, so some folks who have extreme claustrophobia may not be able to undergo treatments. I've had some of the most claustrophobic patients been able to undergo hyperbaric oxygen therapy and kind of be able to do this over time. Otic barotrauma is a fancy term for pressure, high pressure in the ears, because people are, there's more pressure coming into the body. Unfortunately, the ears have to kind of deal with that and hopefully equilibrate the pressure coming in. So many people are able to do that as long as you're able to clear your throat or unpop or equilibrate the pressure in your ears. It's like going up in an airplane. That's what it feels like. Seizure disorders, it's not always great for folks who have pre-existing seizure disorders and actually may cause a seizure. I've never seen this happen in my years of practice. Reduced blood sugar and diabetes, pulmonary hyperexpansion, we're taking in more oxygen to the lungs. So not always great for people who can't get rid of the oxygen or carbon dioxide in their lungs. And then sometimes people notice something called a detox or die-off reaction. Because it is known to treat or help to eradicate different types of bugs in the body or viruses, sometimes people can feel kind of a die-off or a detox reaction, especially if they have environmental toxicity. Contraindications, typically we're never going to treat somebody who has compressive brain lesions. First trimester pregnancy is a contraindication, and active head colds. When you have an active head cold, unfortunately, you have a lot of stuff in your nasal passages and your sinuses, and sometimes that pressure can cause the fluid to become very uncomfortable when you're inside the chamber. So not always great when you have an active head cold, but that's typically can be avoided by just not getting in the chamber when you have the cold. What to expect? So some of the side effects, yes. During the treatment, again, ear pressure is a very common side effect. It's usually resolved within the first 5 or 6 minutes of the treatment. Better or deeper breathing and a deep state of relaxation. I've seen it across the board. Most people get in the chamber and fall asleep, including myself. I have some of the best naps ever in meditative states when I'm inside the chamber. It's great. After the treatment, typically some occasional headaches, but the improvements are great. Better energy, stamina, exercise tolerance, better sleep, better mental acuity. I've had some people who notice that their eyesight becomes better, improvements in symptoms of diseases, of course. And then in autism specifically, better communication, better behavior, less hand flapping, and better motor control. So how often? We talked about this before. Most studies suggest at a minimum of 20 treatments, up to 40, potentially more treatments are optimal to treat many chronic conditions, and many patients will need more than 40 treatments depending on the severity of the condition. Because this is not covered by insurance, there are, I think, 15 or 16 or 17 FDA-approved conditions for hyperbaric oxygen therapy where insurance will cover it. We do offer packages to help people kind of offset the cost of doing many treatments in the chamber. So Conscious Human Medicine is our practice. Please check it out. A little bit about our practice. Conscious Human Medicine was inspired by the fundamental belief that we all have the capacity to become our authentic, fully expressed selves. Now, our desire at our clinic is to facilitate this awareness and bring about transformation in as many people's lives as possible. We have a wide array of diverse, cutting-edge set of tools and techniques, including hyperbaric oxygen therapy to prevent and treat chronic disease. And then, of course, we always want to be able to help, even if you don't have chronic disease, we want to be able to help people enhance their physical and cognitive performance as well. So besides hyperbaric oxygen therapy, we offer a number of great things in our practice, including naturopathic medicine, which we've mentioned throughout this talk, intravenous vitamin therapy and vitamin shots, something called prolotherapy and platelet-rich plasma therapy, biofeedback, far infrared sauna, biopuncture, and a lot more. So when you get a chance, please check out our website at www.conscioushumanmedicine.com. Our phone number is 424-331-0030. And if you're interested in scheduling, please reach out to us, shoot us an email, get on our website, check out all the things that we have to offer. Thank you so much for your attention today, and we look forward to seeing you in the future.